An elderly woman called the News 2 I-Team after a hip replacement surgery in the hospital led to a strip search in a local nursing home. She says she feels violated, angry, and wants answers. So we sent News 2's Rebecca Collette to investigate what happened and find out if it could happen to your loved one.
Shirley is enjoying life and independence with her new hip, but at night, fear creeps in.
I was humiliated. I just can't get over the nightmares.
You see, after surgery, she checked into a local nursing home for rehab, where she says things went terribly wrong for her as soon as the nurse told her to strip naked.
I didn't go there to be violated. I went there for physical therapy.
I learned strip searches are part of the process for every patient.
To see if I had been abused, if I had any infections, if I had any bruises. Why would they look at your private area if I got bruises?
Apparently, it's the law. I looked into DHEC codes, which require nursing homes to complete physical examinations that address the resident's physical condition and diagnosis. When I asked what that means, DHEC told me, quote, "The scope of the admission and physical exam is to be determined by the professional judgment of the attending physician or legally authorized healthcare provider." That's why the state nursing home regulation requires either a physician or legally authorized healthcare provider to conduct them. The state regulation does not address cavity searches specifically.
Like I told us, I hope you enjoyed it this time because you're not ever going to touch me again.
Shirley filed this police report and checked herself out of the Presbyterian home in less than 24 hours. I spoke to the CEO of the Presbyterian home in Somerville over the phone. She would not speak with me on camera or provide the facility's policies on strip searches. She said an internal investigation found no wrongdoing. DHEC is still investigating. Now Shirley wants to make sure others know it could happen to them. Here's why. According to DHEC, after admission, facilities are required to monitor residents on a routine basis to decrease the risk of residents developing pressure-related wounds, bed sores. Attorney Jamie Kahn, who isn't associated with this case, he says it's important for families to know what they are getting into before arriving at a facility.
These facilities all have multiple page documents for the admission of your loved one, maybe 35 pages or more. Those documents at times can impact substantial rights.
Kahn says get those documents in advance and review them for details about payment, approved doctors, waiving rights to sue, and standard operating procedures. Once you're checked in, if something's not right, document it.
I think pictures and notes are appropriate.
DHEC recommends using the Medicaid website to do your research. You can compare facilities side by side for overall care, rating of staff, and DHEC inspections.
I'm not me anymore.
For Shirley, her hip is healed, but she's still recovering from her one night in the nursing home.
DHEC says an investigation can take months. The agency's policy allows you to bypass strip searches if you're under the care of a doctor before being admitted to a nursing home. For more details on that policy, you can head to counton2.com. Rebecca Collette, News 2.
And remember, if you have something you want the I-Team to investigate, just email us, iteam@wcbd.com. Call the I-Team hotline, 843-216-49.